Hi, Mr. Gonzalez, Performing Hand Hygiene. My name's Yvette. I'm going to be your nurse today. I'm here to do a hair, nail, and skin assessment. Is that okay with you?
Yes.
Okay, before we begin, I'm going to go ahead and ask a few questions. Do you have any history of skin cancer?
No.
Do you lay out in the sun to tan or use tanning booths?
No.
And when you do go out in the sun, do you use any sunscreen?
Yes.
Okay, that's good. I'm going to start off by doing a skin assessment and inspection. So I'm just going to look for the color of your skin. I'm going to make sure there's no erythema, which is redness, no pallor, which is paleness, no cyanosis, which is blueness to the skin, or any jaundice, which is yellowing of the skin. I'm going to go ahead and look here. Go ahead and just move your arms here for me. Just checking here. And I'm also looking at the extremities, lower extremities here. I don't see any signs of any of those, which is a good thing. Now I'm going to go ahead and check for temperature and moisture. And by that, I'm going to use the back of my hands and feel along your arms and legs here. So I'm going to go like this here. Temperature is warm and moisture dry, which is a good thing. Now I'm going to go ahead and check for mobility and turgor. And for mobility, it's by pinching the skin here, and that's how easily the skin pinches here. And then turgor is how fast it flattens back, how the skin goes back to normal. I would say mobility and turgor is normal. And while I felt with the back of my hands on the skin here, I was able to see and feel that the skin was smooth and thin, and the only places that has thick skin would be at the palms of the hands and the soles of the feet here. Now I'm going to go ahead and check for any edema or bruising on the extremities, as well as the abdomen and chest area. First, I'm going to check the arms here. No signs of edema or bruising on any of these arms. I am going to check here. I don't see any sign of edema or swelling. I do, however, see 2 bruises here, Mr. Gonzalez. Does that hurt?
No.
Could you tell me where you got that from?
I work for my toolbox.
Okay, that's fine. Bruises seem like they're healing already nicely. Now I'm going to go ahead and look at the lower extremities for any edema, swelling, or any bruising here. I don't see any bruising or any swelling on the lower extremities, which is good. Now I'm going to go ahead and check for lesions, which is like moles or any freckles, or any papules, which is like acne type of raised bumps on your body. I don't see any moles or anything like that. I do, however, see a few macula, which is freckles, and they're brown, which is good. Nothing of concern for them. Now, Mr. Gonzalez, before I have you stand up, I'm going to go ahead and check your lower extremities for any moles or anything like that. I don't see any moles, any other lesions of concern. Okay, Mr. Gonzalez, if you could stand up for me, and I can go ahead and check your back real quick. Mr. Gonzalez's back here, I do see a few freckles or macula, which are brown, nice and brown, nothing of concern. A few papules, but nothing concerning, and no moles present whatsoever anteriorly or posteriorly here. Color seems good on back skin, which is good. You can go ahead and take a seat, Mr. Gonzalez. Now I'm going to do the hair part of the assessment. So I'm looking at color, which is black, and I'm also looking at texture of the hair, which is smooth. I'm also looking at hair distribution here, which is symmetrical. I don't see any bald spots or anything like that around the head, which is good. And lastly, for the hair, I'm also going to inspect for any infestations or any lesions in the hair and the head. So I'm just going to part the hair like this, all around the head here, parting to the side, parting down the middle and everything, checking for any lesions or infestations, which no visible infestations or lesions are seen here. So that's a good thing and it's normal. Now I'm going to go ahead and check your nails and your hands. First one here is I check for shape, which is rounded. Some of them are flat, but it is okay as well. Excuse me. And I'm also checking the profile sign of the nail, which should be 160 degrees or less. And Mr. Gonzalez's profile sign is 160 degrees, which is good. Now I'm checking the consistency of the nail bed by pressing like this here. And it's firm. I can see that his nail beds, the color is nice and pink, as well as capillary refill on this hand is less than 2 seconds. Now I'm going to go ahead and look at the other hand here. Checking consistency of the nail bed, firm, as well as capillary refill is also less than 2 seconds. And I see that the nail beds are nice and pink. Okay, Mr. Gonzalez, if you could put your feet up here, I'm going to check your toenails now. You don't have to do a profile sign on the toes, but you do have to check shape and color. For example, shape is rounded. If you do see a little bit of yellowing, that could be a sign of fungal infection, which I don't see any of that. Nail beds are nice and pink, and consistency of nail beds are also firm, which is good. As well as capillary refill is all less than 2 seconds. And that is good there. Now, Mr. Gonzalez, before I finish up the assessment, I do want to do a little teaching on signs of skin cancer and what could be of concern for you. In order to do this, we follow a rule known as the ABCDE rule. A stands for asymmetry. So if you have a mole or you see a mole, asymmetry means that both sides should be the same. They should match up. B is the border. The border of a mole should be smooth around the whole thing. If you see the border jagged or any irregularities, then that should be of concern. The C is color. So the color of a mole should be consistent throughout. It should not be yellow, blue, brown, black in the same mole. And then D, which is diameter. If you see a mole and you think of any concerns, it's better to measure the diameter, and it should be concerning if it is bigger than 1/2 inch. And last but not least, E is elevation and enlargement. So if the mole has a rise to it or has gotten any bigger, that should be a sign of concern. And that is the end of our skin, hair, and nail assessment.